Ladies and gentlemen, let us continue with agenda item number 5, report of the 32nd Standing Committee of the Regional Committee for Europe. For this item, the relevant documents are displayed now on the screen. And I would like to give the floor now to the chair, Dr. Thomas Dentzer, Chairperson of the 32nd Standing Committee, to deliver the chair's report. Dear Thomas, you have the floor.
Thank you very much.
You're ready.
Honorable Ministers, dear Regional Director, esteemed delegates, ladies and gentlemen, it is an honor to present the report of the 32nd Standing Committee of the Regional Committee of Europe, the SCRC. In 2024-25, the SCRC met 5 times, twice in person at the UN City in Copenhagen and 3 times virtually as part of the organization's cost-containing efforts. In this SCRC cycle, we welcomed new members from Croatia, Ireland, Portugal and Turkey. In accordance with the rules of procedure, I had the privilege to serve as a chair with Ms. Asta Valdimarsdottir of Iceland as a vice chair. A central thread of our year was stewardship in a time of exceptional financial challenge. At the regional director's request, program budget matters was a standing item on our agenda. We examined the evolving financial situation, including implications of the intention by the government of the United States of America to withdraw from WHO, and provided guidance on cost containment and prioritization. Measures to reallocate funds, reduce travel, and streamline operations began to yield results, with 2.7 million in savings that were reported mid-year already. But this was only the beginning and the immediate actions that yielded some success. While the most difficult task was to do a complete review of current WHO Europe activities and trying to align this with member states' priorities. An enormous task that resulted in organizational restructuring, which is still going on, and the proposition of EPW2, which was received with such a support by all of you yesterday, and I'm really happy that we can conclude this. Let me thank everybody who worked on this, and especially Melita and Gundo, who worked tremendously to get this work done and aligned with the priorities of all of us, the member states. On top of that, our working groups, the subgroups, were central to the governance agenda and country-level insight. In response to the financial context, both groups adjusted their terms of reference while advancing time-bound tasks. The government subgroup, chaired by Rachel Kenner from Ireland, supported the SCRC in this year's nominations and election process, and also in taking forward the implementation of standard operating procedures for geographically dispersed offices endorsed at RC last year. The subgroup on WHO Europe's work at country level provided vital feedback on EPW2 development from the country perspective, provided reflections on WHO Europe's comparative advantage through a structured process, and gave valuable feedback on the approach to the review of country officers, which began mid-year in the context of the financial challenges. Therefore, also thank you, Björn, for leading this, and Rachel. It was an honor and a pleasure to work on the groups. Prepared for RC75 in the current financial circumstances required really difficult choices. The SCRC reviewed several options and ultimately endorsed a reduced cost in-person session. We judged that convening our region's public health community face-to-face, even modestly, supports essential networking, trust building and accountability. And I'm pretty sure that all of you see it the same way, and I hope that we can continue seeing each other and having human interactions, because they foster a lot more than just online virtual meetings. We further accompanied and scrutinized the strategic prioritization and restructuring process from the very beginning of 2025, which I still remember being here in January when the United States announced that they would just that they wanted to pull out of the WHO. I would like here to emphasize the proactive approach that the team here in Copenhagen took in order to come up with solutions under the leadership of the regional director. I'm sure that all of the work and the in-depth review and process will come to fruition in the next months. Not only was SCRC kept updated on a regular basis, but the team also listened attentively to the chair and the vice chair of the SCRC. And on a personal note, I'm very thankful that Dr. Kluge gave me, as the chair, the opportunity to contribute and challenge him while discussing various approaches to tackle the current problems and to transform WHO Europe to continue to perform for its member states. Thank you very much, Hans, for the opportunity. Esteemed colleagues, the 32nd SCRC has thought to be a reliable and steadfast bridge between member states and WHO Europe, guarding governance, guiding strategy, and supporting forward momentum despite adversity. Our achievements this year are not measured only in documents and decisions, but in the resilience they embody, a secretariat that adapts while protecting core functions, and member states that remain engaged, pragmatic, and forward-looking. I extend my sincere thanks to all SCRC members, our vice chair, the subgroup chairs, the regional director, and the secretariat. Your professionalism, candor, and dedication have carried this work forward as we continue our deliberations at RC75. Let us take the opportunity to reaffirm solidarity and protect health gains while building for the future. We need to look at the current situation now really as an opportunity to make WHO stronger and to focus on what matters. Let's stay critical but constructive. Let's do prioritization and do things different with less. After all, it is what you make out of it that you gain. I'm sure that together we can ensure that our region remains a beacon for health, equity, and public health excellence. I'm counting on all of you in the future to support WHO and its mission and to really live, leaving no one behind. Thank you very much for your attention.
Thank you, dear Thomas. Are there any questions or comments on this report? I see Sweden has asked for the floor. Dear Björn, please.
Just one short comment. I want to express my gratitude to the leadership this turbulent year. It has been excellent, and Thomas and Asta has made it very, very good, and included everyone in the SCRC and also Hans. So great thank you for your transparent and hard work.
Thank you very much, Björn. Any other comments from the floor? If not, dear Regional Director, would you like to add anything? Please.
Thank you. Thank you, dear Asta. I definitely want to add my gratitude. Like I was mentioning the first day to you, dear Thomas, it has been undeniably a wonderful journey of collaboration, like dear Björn was mentioning. Thank you, Björn, for these words. And I also want to acknowledge and extend our sincere appreciation to the other outgoing SCRC members from Greece, Romania, and Ukraine. Your unwavering commitment and your contributions during these last 3 years have made really a big impact, and we are very, very grateful. I would like to express also my thanks to the entire SCRC membership for their continued support, for always nudging us to go one step further, to think afresh in uncertain times for everyone. And looking ahead, I'm confident that we will be able to build upon the successes now. We let the foundation, guided by participatory governance, as you were telling Gabriel, as a cornerstone of trust, transparency and accountability. Thank you.
Thank you very much. With that, we could conclude this agenda item.